Well, thank you guys so much for being here today. I'm so excited to go through this training with you guys. I don't know if any of you guys have been following me for a little while or not, but I really think that today can be super life-changing for you if you're struggling with hip impingement and labral tears or you've had surgery or anything like that. So I'm really excited to share all this info with you. So, if you have been through physical therapy before and you feel like you've tried all the stretches and you've tried resting and you've tried injections, maybe surgery, or maybe you're just at a point where you're not even sure if you should be having surgery or what you should be doing, this is going to cover that today and hopefully give you a little bit more insight into what's happening in your own body. So, you're in the right place if you fall into any of those categories. And I think the reality is that for many people, um, I just think that traditional physical therapy really misses the mark on treating patients that have impingement and labral tears. I see it pretty much every day in my clinic. Mostly patients come to me after they've failed a lot of other options. And so I know I see the other side of it that there is still possibility and hope. So if you're feeling a little bit lost and like you don't really know where to turn or what to do, or if there is even a solution for you, I guarantee there is. You just haven't had somebody take the time to show you what is possible. And my goal in life is to really try to fill in those gaps for people that traditional physical therapy is really missing out on. What I do want you to know right off the bat is that this training, it's not going to be a step-by-step exercise plan of what you need to do to make your impingement and labral tears better. I am of the belief that there is no magic exercise routine or exercise that you're going to find, whether it's, scrolling on Instagram or TikTok or whatever. There isn't a magic exercise that's going to make this better. I think one of the biggest questions that people come to me asking is like, what should I do? What's one thing I should do? And the reality is it really does depend because it depends like what's happening in your own body. Where are you at in this hip journey? There is no magic exercise that's going to fit the same for all people. What I'm going to share with you today are some of the common things that I see and some of the common exercises and corrections and resets that will help. But if you don't fall into a category where these do help, please know that that doesn't mean it's the end of the road. It just may not be right for your body. And that's also why I don't often share a lot of really specific exercises because it isn't realistic to think that one exercise is going to work for every single person. So that is, that cookie cutter exercise routine that you're going to follow. It's just not something that I feel that I'm able to give people. But what I can offer to you is a framework of what steps you should follow to be able to solve this for your own body. And so over the course of, I've been doing this for 13, almost 14 years. Most of that time has been spent working with people that have different hip issues. I really have been able to develop a framework of what works so well for my patients. And that framework is what I want to share with you today. And it's what I speak about in pretty much anything that I do, whether it be, I've got a book coming out, I have an online program, or if I'm working with you one-on-one in person or virtually, the framework that I follow is the same. And if I can share that framework with you, it's really easy to take it and implement it into whatever physical therapy you're doing, whatever exercise program you're doing. And now, instead of there just being this magic exercise routine that you can do, you can take this framework and make everything work for you. Any exercise works. And so that's what's really cool about it. And I'm excited to kind of share a little bit more about that with you today. So if you guys don't already know me, again, I don't know how long you've been following along, but I am a physical therapist by trade. I have a small clinic here located in Gainesville, Virginia, which is like Northern Virginia outside of DC. And I actually started as a dance medicine specialist. So I work with performing artists, gymnasts, figure skaters, kind of anything under that category. And as you can probably imagine, that group of people, those dancers, they have a lot of hip issues. So I started treating hip impingement in particular, and labral tears are extremely common in this population. And so I started treating it a lot. I was just seeing it a lot. And over the years, it's people kind of have come to know me as like the person that treats hips around here. And so again, I was able to sort of look at, well, why am I getting different results than other physical therapists are getting? Why are these patients coming to me after they have failed everything else that they've tried and they have so much success when they work with me? And and I really had to kind of look at, well, what am I doing differently? And I think ultimately it's because I follow this sort of framework. And when I was first starting out, I never put two and two together that I even had a framework for how I did this. But over the years, I've really developed it into something that's a little bit more specific. And now what's really cool is I don't just work with people that are in person anymore. Now I can work with all of you virtually online and take that exact same framework and replicate the same results whether you are physically in my clinic or not. And I do think that that is really what makes this a little bit different. When you're a PT who stares at hips all day long, you start to see things in movement patterns that other people just aren't seeing and that they're missing. And the reality is, too, I think a lot of physical therapists are, the system isn't great. So you're often filtered through really quickly. You're working with an aide or a tech or something like that, and nobody's really watching your movement and what's happening. And that can make or break, how successful PT is. So I think that's also part of the problem is they're just not looking at these things, these same things that I am. But whether you're in front of me or not, I can teach you to be able to look at your body the same way and make some of these corrections for yourself. So that's what we're going to kind of go over today. I'm going to walk you through what the framework is that I use. I'm going to take you through I'm going to explain to you sort of what impingement is and what labral tears are, because I really do believe that it's important to just understand what's happening in your body. That's kind of step one. And then I'm going to walk you through just some easy little tests that you can do on yourself, which will lead us then into some movement resets and some exercise suggestions of things to try. So if you guys are ready, we are just going to dive right in. If you have any questions throughout this, go ahead and just put them in the chat. I will, at the end, I'll go back and look through if you guys have any specific questions. I'll also try to save time at the end. If you want to unmute yourself and ask any questions at that point, you can do that as well. So, okay. So what is this framework? So I call it my core framework. So what core stands for, the C is calm and understand. O is optimize movement. R is rebuild strength. And then E is elevate performance. And so basically, when I am working with a client, what I like to do is walk them through each phase of this journey. I truly believe we cannot skip over steps here. It has to happen in this order, and they all have to happen in order for you to have success. Now, how fast somebody is going to move through each of these phases really depends. That's where, it's not like 4 weeks, it's 4 phases, because everybody's going to move through at a different pace. But ideally, the very first thing that you want to do when you're figuring out, okay, I have impingement, I have a labral tear, whether you've had surgery or not, like, what the heck am I supposed to do? Where do I start? Well, you have to be able to calm down your pain. If you are experiencing inflammation and irritation, you have to know, what do I do to start to get that inflammation down? I can't start with strengthening exercises if I'm in an inflamed state. So we have to be able to get that irritation down. And alongside that, the second piece of the C, it's calm and understand. Understand meaning understanding what's happening in your body. I do really believe that makes all the difference for people when they understand what impingement is, what is happening in their hips, how they're moving. That fear, which is, it's nothing wrong to be afraid of, but that fear that is there of, am I doing something wrong? Am I going to hurt myself? Like, what is happening? When you actually understand what's going on in your body, that fear starts to fade away. And so the fear and the anxiety can sometimes create more of your symptoms. And to be able to really effectively calm everything down, we do want to have you have to understand what's happening. So that's the first phase. Primarily, that's what we're going to be talking about today in this training. But I do want you to know the next steps. So after your symptoms, after you find things that start to calm your symptoms down, it's usually going to be 1 to maybe 2 exercises, nothing crazy. But the next thing that you want to do is optimize your movement. And so what we mean here is retraining movement patterns. Now, we are going to talk a bit about what the common movement pattern problems that I see in people with impingement are. Um, and so there are, again, everybody moves differently, but there are some really common patterns that we see with this issue. So we're going to walk through, what those are, and then you have to be able to know how to correct them. Because if you don't correct the movement patterns, and we jump ahead into strengthening, you're essentially layering strength in on top of the wrong pattern, and now you're going to make that dysfunction a little bit worse. So everybody talks about you got to be stronger, you have to work on strengthening. Yes, that is true. However, you have to make sure that the precursor to that is that you have learned how to move properly. Then we layer in the strength to reinforce those patterns and make sure that you're moving in ways that are productive and efficient and are going to contribute to lessening your symptoms versus flaring them more. So in this rebuilding strength phase, again, there's lots of variation on what muscle groups you're going to work on. All of that, it really depends on where you're at in your journey and what your imbalances are. But we're really just trying to rebuild your body up to get a really strong foundation so that you can move into the last phase, which is elevating performance. And so for any of my athletes out there, or if you're a dancer, this is where we are talking sport specific exercises and drills. However, if you are not an athlete or a dancer and you're just, a mom or somebody that likes to casually work out or run or anything like that, this is just getting you back into all those activities that you love in a way where you have no symptom flare ups. This last phase, when we get to elevating performance, the goal is that you are not afraid anymore that what you do is going to spike your symptoms. Flare ups are sometimes inevitable, but there's a big difference between being afraid of a flare up happening in that early phase, like when everything is still really irritated and not calmed down, versus when you get to this last phase and you don't have hopefully pain anymore and you're not that fear around flare ups is just so much less. You're so much more confident in your body's capabilities. And the progression feels a lot more natural, whether it's, getting back into a return to run program or you're getting back into the gym, doing heavier lifting, anything like that. So the idea is that you work through all of these phases and you don't skip over steps, but you do them in this order on your body's timeline. And again, the really cool thing about this framework is that you can take this and apply it into whatever it is that you're doing. So if you are doing exercises on your own, you can look at this and say, have I done all of these things? Or where am I even at on this, in this method here? If you're doing physical therapy, same thing. If your physical therapy isn't hitting all of these points, doesn't mean you need to leave that physical therapist, but can you take what you learn here and implement it into alongside the physical therapy that you're currently doing? And that can make, again, a really big difference, kind of filling in some of those gaps. So I would love to know too, if you guys kind of where you see yourself in this pyramid, if you will, where you feel like you fit into. Are you super inflamed and you're kind of stuck at that phase where you just have to calm and understand what's happening in your body? Or do you feel like you've gotten past that, maybe with PT or something that you've done before, and you're stuck at a different phase of like, I can't rebuild strength or something like that? So just write it in the comments for me. I'd love to know, where you see yourself right now too. Okay, so that's the framework. Let's dive in a little bit more. Like I said, we're going to focus a lot on sort of that first phase, that calming and understanding. Since most of you guys are probably new to my world, we want to start at the beginning. So we're going to talk about what hip impingement is, what is even happening in the hips. So I'm going to get my little hip model here to kind of demonstrate this for you guys. So there are a lot of different diagnoses that kind of fall into this category. Certainly hip impingement is one. We'll kind of explain what that is. Labral tears, hip dysplasia. If you have dysplasia, this all is still really applicable for you as well. Even to some degree, hip arthritis, this is going to be really applicable. So when we look at the hip joint, there's kind of two main things we're looking at. There is the head of the femur, which is like your thigh bone, right? So this round ball, the head of the femur. And then the socket here is actually on the pelvis. That's called your acetabulum. So if you've ever heard the term FAI, what it stands for is femoroacetabular impingement. So big fancy word for basically just telling you what the joint is. And so when we move, so we're going to talk about flexion. So flexion is anytime your knee comes closer to your chest. So just imagine the rest of my leg is there. Um, Really at the root of impingement and labral tears and all of these things, there's one key thing that has to happen. And if this doesn't happen, it contributes to the majority of the symptoms. So when I flex my hip, the head of my femur has to stay in the center of the socket, which means it actually has to glide sort of down and back a little. Now, you can't see it too much because there's not a whole lot of movement that happens. It's very internal. It's this tiny, like millimeters of movement within the socket. It's not dislocating or anything like that. But as I flex, it has to glide sort of down and back into the socket. If not, I'm going to like way exaggerate this. It does not come out of the socket, I promise. It comes too far forward, and you can see it's going to create compression on the front side of that joint. So if I come too far forward, I get the compression here on the front, which if you have impingement, you probably have experienced at some point that hallmark catching, clicking, pinching, or just sharp pain, like right on the front side of that joint. That's generally what it's coming from. It's coming from this compression forward. Now, we have to be able to get head of the femur to stay centered in the socket. And there's a lot of muscles at play there that have to, there's, a lot of different things that have to happen for that to take place. It's a mixture of making sure you have enough mobility. So there is, we call it the joint capsule, which it's basically like the shrink wrap around the joint. And it's the ligaments that hold all of this together. There has to be enough mobility there so that you can actually get some gliding that happens within the socket. So if you are missing mobility work can be really helpful to restore that glide. The other piece of it is stability and strength. What I will tell you, what I generally see in the majority of my clients is that it's not so much a mobility issue, it's more of a stability or a strength issue. Now, can you have both of these simultaneously? Yes, absolutely. But I just, again, from seeing so many people in this situation, I know that the majority of people struggle the most with stability and control. And so when I go into my flexion to get that sort of like down and back glide, a couple different muscles that I really need to be strong and to not even be strong, but to know how to coordinate together at the right time. So one of them is your hip flexor. So the hip flexor is right on the front of the joint. And when it contracts, it pulls the knee towards the chest. It also makes sure that this stays centered in the socket based on where it's attached. So without getting into too much of the mechanics of everything, there's another set of muscles, and I'll kind of show you on this like outer part over here called your TFL. So when hip flexor is weak, hip flexor is over here. When it's weak and it's not doing its job, this slightly lateral muscle called your TFL, which is also the top of your IT band, it likes to take over. It likes to be like, okay, well, hip flexor's not doing its job, so I'm just going to flex that hip. Well, the problem is TFL isn't, its main job isn't hip flexion. It helps with hip flexion, but it's not supposed to do all the flexing. But it ends up taking over when hip flexor's too weak. And because of where it's attached, if it's doing too much of the work, it pulls the head of the femur forward in the socket. And this is also why many people with impingement or labral tears feel this like gripping through here or this constant tension. Now, where a lot of people go wrong because they're like, well, I feel all this restriction. I feel so tight through here. And what's the natural thing we're going to do if we feel pain or we feel tight? We're going to try to stretch it. Stretching it very often has the opposite effect where it can either do nothing, like nothing changes, or it will sometimes make the pain worse because of the position that you have to put the joint in. And so we obviously don't want it to make it worse. If it's just changing nothing, it's usually not changing, it's not making your symptoms any better because it's not actually going after the root cause of why it's tight in the first place. which for most people is that it's not, the muscles aren't coordinating properly. It's not strong enough. And so we have to make sure that we're really looking at, well, what is the root cause of your mobility restrictions or where your pain is coming from? Because if we don't target that piece, it doesn't get any better. So ultimately, we have to look at this as like a movement issue. We have to figure out, how do we move in ways that targets that root cause? So that's sort of what's happening on the front side of the joint. There's also a lot going on the back side of the joint here too. So on the back, we have a group of muscles called your deep hip rotators. Now, there are 6 of these altogether. These muscles also make up the back side of your pelvic floor. So, big connection here between hip pain, pelvic floor dysfunction. So, if any of you guys are having, we'll kind of talk about the symptoms too, but if any of you guys are feeling some pelvic floor symptoms, things like that, many of my clients come in and they're like, oh, yeah, I'm having problems with leaking or whatever. It's not related. And I'm like, oh, yes, it is absolutely related because they're the same muscles. So there's a really big tie in here. So these deep hip rotators, they sit on the back side of the joint, and their job is to kind of hold the head of the femur, as mine's falling out here, hold the head of the femur into the socket. And so they create rotation within the joint when they contract, but they also create some good compression, the kind that like kind of holds everything together. It's what creates your stability. Now, we're not talking about, in this case, these stabilizers. I'm not talking about like the big glute muscle on the back. That's more of like a power muscle. I'm talking deep. Underneath this, you can usually kind of feel them when you know where your sits bones are that you sit on in your butt. That's sort of up where they are. Kind of like press up and under. Kind of like right where your butt and your thigh meet. I call it your thut, right in there. That's sort of where you can feel those deep hip rotators. Those muscles are key to finding and being able to activate and be strong in, because they are going to help stabilize that joint. If you're a runner, I know a lot of my runners struggle with impingement and labral tears. These muscles are, they're important for everybody, but they're really important for anything that's single leg, and running is a single leg activity always. You're never on 2 feet. Same thing, my dancers, a lot of single leg activities. Again, just day-to-day life, we do a lot of single leg. If those deep hip rotators aren't firing and doing what we need them to do, it really throws off your hip alignment and your pelvic control and can contribute to your symptoms a lot more. So it's really important to learn how to find and activate that group of muscles as well. So let's talk symptoms. I think certainly there's some variability in what people can feel symptom-wise with impingement. We'll talk kind of about the most common ones. So I would say right off the bat, like the number one thing that people will complain about is a pinching in the hip. So usually on the front side of the hip, sometimes around the back, but usually on that front, like kind of in the groin area, it feels like a pinch every time you do any sort of hip flexion. So that could be squatting down. It could be getting up and down from a chair or the toilet seat, getting in and out of the car, bending over to put your socks and your shoes on. So these are just some of the common things, that I will hear people say. You might also, it may not be a pinch that you feel, it might be a catching sensation. Like it actually feels like something gets caught in there. That potentially could be gearing us more towards, maybe not, it's not just an impingement, but maybe we have a bit of a tear as well. And that reminds me too, I don't think I really discussed the part about where a tear comes into this. So I'm going to backtrack slightly just to make sure we go over that. But so the impingement is when this comes too far forward and I just get the pinching sensation. But on the inside, so on this acetabulum here, there's a ring of cartilage. That's your labrum. It's sort of this like semicircle, and it cushions the joint between the socket and the ball. So it creates a little bit of space in there. And again, that cushion, shock absorption, and it's most exposed on the front side of the joint. So when I have this repetitive glide forward, anytime I flex my hip, it's not staying centered. Over time, it's going to create pressure, pressure, pressure. And we start to get a little bit of fraying or breaking down on the labrum. It can happen once. It can be like one big traumatic thing where you moved a certain way and it tore. or it could be tiny little micro traumas over time. And so we have to, the mechanism at which it happened isn't terribly important if it's there. Either way, you're still probably going to need to correct the movement. But just know that there's many different ways that you can actually tear it. The most common one that I see is that repetitive overuse from not having the right movement patterns. The other thing though is you could also get a bit of maybe that catching sensation would indicate that, it's kind of like a hangnail on the inside. So every time you move into flexion or some rotation, it will catch a little bit. And when it catches, that's kind of our sign that, okay, maybe there's something happening deeper within that joint. So that would gear me towards maybe we need to look at this as a tear. Some of the other really common symptoms that people will get is we call it the C sign. So pain that is sort of like in the joint, like that we call it the C sign because people will make a C with their hands and they'll be like, it hurts in here. And it's almost like they can't really get to it. And they're like, I don't really know how to describe it, but it's like in there. And ultimately, it can be coming from a lot of different things. It can be from some of the muscles on the outside. It can be deeper pain. But that C sign that's like inside the joint, it generally leads us to believe that there's something happening, whether it's an impingement or a labral tear. So those are kind of like the big ones. I think pain can really vary too as like where you feel it. For some people, they feel the pain on the front side of the joint. For many people, they feel the pain on the back side of the joint and in the glutes. I also have a fair amount of people that will get their pain like up into their back. This is also connected. I think it's another one of those areas that people just brush off like, oh, I've had back pain for years. It's not connected. It is absolutely connected. Because when your hip isn't moving the way that it should, what's going to take the brunt of it is going to be the joints above and below. So very often we start to throw off our movement in the back. Same thing goes for the knee. It can lead to some pain down in the knee. So there really are a lot of different symptoms that can come along with impingement. It's just about trying to figure out for you, where is that coming from? So hopefully that makes a bit more sense of like just what's happening. Like I said, I think I take every single one of my clients through this and making sure that they really understand what's happening in their hip joint, because there can be so much fear around, I just got diagnosed with a labral tear. What am I going to do? Am I going to have surgery? Like just so many questions, especially if you start Googling things, right? So my goal is to show people that this isn't as scary as it seems. It is a big deal, right? Like for sure that you're totally valid in feeling that. But also, if you just have somebody that can look at it and say, let's just break this down into terms that make sense, not the big scary words that they found on your MRI and your image and your doctor scared the crap out of you, but just like what is happening in your hip joint. And I will tell you, for most of my clients, when they understand that, they're like, oh, this isn't so bad. I can manage this. And you absolutely can manage it. Hip impingement, labral tear does not automatically equal I have to have surgery. So that's what we're going to kind of dive into next is like, what do we do about movement? So how can we look at movement in a way to figure out can we change your movement so that you don't actually have to go under the knife and have something changed in your hip? Just know too, if you fall under the category that if you're here today and you have already had surgery, this is okay. You still have to learn this piece. Whether you have surgery or not, learning how to move is going to be key, because surgery does not fix how you move. It changes structure, but it does not change how you move. And so much of impingement is how you move. So I have many people who have quote unquote failed surgery. I wouldn't say it's ever failed, right? It's just that nobody's ever showed them, well, how the heck am I supposed to move? So let's talk about that a little bit next. So one of the early on tests that I like to use for people, it's called the rock back test. It's very simple, very straightforward. All you're going to do is you're going to get on your hands and knees. Feel free to follow along with me, or you can, come back. I'll send you guys the replay. You can watch this again later and try it out later. But you're going to come onto your hands and knees, and all you're going to do is you're just going to rock your butt towards your heels. Okay? And you're just going to see, how far can I go? Like, what's my range of motion like? How does my hip feel? Am I getting pain? Am I getting catching? Am I getting pinching? Like, what are my symptoms? And you're just kind of playing with that movement to see like what your hip is capable of. After you do that, you're going to come up into standing and you're going to do a squat. And to be honest, you could do this in either order. It doesn't matter which one you do first, but you'll just test both of them. So if I go down into a squat, I'm going to look and see, again, same thing. How far can I get into my range of motion? Am I getting a pinching? Am I getting a catching? Is it just painful? Like, what do I feel? I'll tell you, most of my people that have hip impingement, when they come in and I say, okay, let's squat, they get to about here. And then they're like, it's my pain. And so it's not normal to feel that, but it is really common. So if you are struggling with squatting, again, this is probably like one of the number one complaints that patients have with impingement or a labral tear. So if you're feeling like you get stuck there, when you go back to that rock back, right? Because if I'm in my squat and I'm like, oh, I can only get about this far. Well, what happens when I take gravity out of the equation and I rock here? Because if suddenly I can go this far and I don't feel pain anymore, well, guess what? This is the bottom of a squat. So the biggest difference is we've just eliminated gravity. When you're standing, your muscles have to know, how do I stabilize? How do I coordinate? How do I weight shift so I don't fall over? All these things, right? And that often leads to the hip not really moving in the right pattern. But if I can get you on hands and knees and suddenly you have all your range of motion, well, that tells me your hip is more than capable of getting into a squat. You have the appropriate range of motion. And especially if it doesn't hurt, that's even better if there's zero pain getting into that. We know that your hip is capable of flexing into the position it needs to be able to get into a squat or getting up and down from a chair or whatever it is. We just have to show it, how do you move to correct that pattern so that now when I am against gravity, I'm not getting the pinching anymore. So that rock back can be a really powerful tool. So I definitely would encourage you guys after this to try that movement out and see what happens in your hips, because this also now becomes one of those early on movement resets. Like I said, I don't believe that there's any magic exercises out there, but the majority of the clients that I work with do really well with this as one of their early on exercises, because it does put them in a position where they don't have to fight gravity and they can just find freedom of movement in the hip. So one of the things that happens when we have pain, especially if you've had pain for a long period of time, is that our body, it wants to protect us from feeling pain. And so it's like, oh, I don't like flexion. So I'm going to guard, I'm going to tense, I'm going to be really tight because it doesn't feel safe to me. And that can in turn lead to more problems. It leads to more pain. It leads to more fear of movement, more muscle tension, all these things. So what we have to do is we have to teach your body like, hey, this is safe. I can do this and it doesn't hurt. And more repetition over time, it changes your nervous system. It starts to tell your nervous system like, hey, this is safe. I can flex. This is nothing bad is going to happen here, right? It's a very safe movement. And so that can be really a game changer early on if you're struggling with a lot of pain. Now, there are a few like little technique things with this that are important to know. So, we talk about how there's these common movement patterns that we see in people that have impingement. One of the most common patterns is I call you guys chronic butt clenchers or butt tuckers. So what you want to make sure that when you're doing this is that your back is staying neutral. I'm not rounding and tucking my butt under. So that's a really common pattern, is like this gripping, this glute gripping that we see in people that have hip pain. Partly it's just a movement habit that happens. And partly it's because of a lack of stability. So when the hip doesn't feel stable and these deep rotators aren't firing and doing their job, the bigger glute muscles on the outside are like, well, we got to have some stability from somewhere. So I'm just going to tense and grip. And now it's like, okay, my hip feels stable. So it's like this false sense of support that your body gives itself but it's not an efficient use of the muscles or the correct muscles. And so we see that glute gripping very often. And then in the rock back, you'll kind of see it happen again. So, what you want to teach your body to do, and you might need a mirror or something, but you want to teach your body to not grip the glutes. So, as I come back, I stay neutral. And if you start to feel yourself butt tucking, relax it. Or if you feel like you can't relax it, don't go that far. So, it might be a smaller movement for you. Um, and that's okay. There's nothing wrong with that. It's more important to do the movements with good quality than to push through them incorrectly. The other thing too is if you are still feeling a pinch or a catch here, you would limit your range of motion there as well. Not everybody's going to get all the way down here. That's totally fine. You just go as far as you can before you feel that pinching or the catching. So yes, we got neutral spine, limited range of motion based on your symptoms. And then you kind of the last little thing is just making sure that you're like staying relaxed. So when you come back, there should be almost like a crease in this hip. So if you are, again, if you're tucking under, this is going to kind of, you probably can't see with my clothes here, but it's going to flatten out and it should crease and flex. So like a hip hinging motion, I should flex from my hips this way, right? Now, this here, again, a little easier because I'm not having to support and stabilize, but as you can see, it's not only the start to a squat, it's also the start to a deadlift. So, and those are two extremely functional movement patterns, exercises that you might already be doing. But if you don't know how to hinge at the very least, those movements now can actually aggravate things and make it a little bit worse. So try that out. And then, as always, I'd love to hear feedback of if it helps for you. And yeah, we'll see if that makes some changes for you guys early on. One other little thing that we can touch on too, I'm not going to get too much into like the ins and outs of diaphragmatic breathing, but early on, something that can be really helpful is learning how to diaphragmatic breathe. And the reason for this is, well, there's a couple of reasons. I'd say the most important is that it's some nervous system re-regulation. So as I mentioned, when you have pain anywhere, not just the hips, but if you have pain anywhere, and if you've had pain for a long time, your body starts to learn how to protect itself. So there's a lot of extra tension, there's a lot of extra guarding. You're kind of in that like fight or flight mindset. So you never know if your next move or step is going to reproduce the pain. Now, there's nothing wrong with that, right? That's really great. And our body needs that protective mechanism. But sometimes it ends up becoming more of a problem, especially if it's been going on for a long period of time. And so we have to teach our body how to re-regulate. When we can let some of that tension go, I think you will find your hip pain starts to come down. There's a big tie-in between stress, tension, and the pain that you feel. So diaphragmatic breathing is a really good way to start to re-regulate that. So again, I'm not going to get into like the nitty-gritty of it, but at the very basic premise of it is that if you kind of imagine your core like a canister or even better, a balloon, the bottom of the balloon is your pelvic floor here. And then the top of the balloon is your diaphragm and your rib cage. When I take my inhalation, I have to fill the balloon with air. Now, if you think about a balloon, it opens not just from the top and the bottom, all the way around. So when I breathe into my abdomen, I have to think about breathing all the way around. Sometimes people will call this 360 breathing because you have to breathe all the way around that canister. That also means pelvic floor, kind of breathing into and lengthening the pelvic floor. So when I inhale, my belly is rising and expanding. When I exhale, it's just going to be like the air retracting out of a balloon and it's going to come back. You're not going to come all the way back to like a contracted state. You're just going to come back to resting. So just practicing that inhale, release, exhale, retract, that will start to kind of resets that nervous system to down train everything and say like, hey, this is safe. I'm okay. I can let go of all this extra tension that I'm holding on to. And a lot of that extra tension just finds its way into our pelvic floor and into our hips. So my people that have impingement and labral tears tend to be people that have a really hard time figuring out how to diaphragmatic breathe. And it takes some practice. It's not like, oh, I do it one or two times and like suddenly I know how to do it. This is, probably needing to practice for 5 minutes or so at a time, at least every single day, to find how do I deepen that breath. As you do it, you will actually start to feel the ability for those pelvic floor and hip muscles to let go when you take that inhalation. Sometimes you don't realize in the beginning how much tension that you're holding there. So it is a really good way to just bring some awareness into your body, and early on starts to calm the symptoms pretty quickly. So I would say that it's pretty important when we're looking at like a plan of what do you do for your hip pain. It's important to have some things that work in the moment, right? If you're up in that first phase where everything is really irritated and inflamed and you just need to calm things down, starting with something like breathing and rock backs or, gentle movement is a really good place to start. But even if you're in those later phases, if you have a flare up, rather than continuing to push through and strengthen and do all these things, go back to basics, go back to the beginning. Some of these really simple things, maybe it is just breathing, and revisit those things to get the symptoms to calm back down. It's all about finding those one or two things that feel the best to your body, that let some of that tension and irritation go. And then you go back to them anytime you need them. In the beginning, you're probably going to need them more often, and then as you get further down in your journey, you won't need them as much anymore. You'll just need them if you flare up. But it's nice to always have those tools in your back pocket, should a flare up happen. That kind of always also brings me to the next point, that you have to have like the things that work right now in the moment when I flare, but short-term fixes like that are not going to solve long-term problems. At the end of the day, you still have to have this framework in place that you're now going to take that hip that's nice and calmed down and do something with it. You have to learn, how do I re-change these movement patterns? We really only talked about one of those movement patterns today. There's a lot of other ones too. How do we change some of those patterns for the better? And then how do we layer strength on top of it, so we're reinforcing it with every movement that we do? And that pathway is kind of ultimately what is going to get rid of this long term for you, versus I do things that make me feel better and then I just go back to whatever activity I was doing before. And then it hurts. So then I have to rest. And you get stuck in this loop. And it's so frustrating to be stuck in that loop. You just have to figure out, well, how do I get out of that? And ultimately, the way out of it is by figuring out, how do I calm my symptoms? How do I change my movement patterns? That's key. Then I layer in strength and performance after that. If you can follow that pathway, you are going to be golden. So I hope that makes sense to all of you guys. Again, I could talk about this for hours and dive into all of these topics individually for an hour-long workshop. So a brief little introduction. If you feel like up to this point you have gotten out of this what you were hoping for, you can stop here. We are good with all the content. If you are wondering, what do I do about this? Like, how do I actually put this together? Let's chat a little bit more about what I can offer you guys, because as I said, one of my big goals is figuring out, how can I fill in these gaps that traditional physical therapy is just not hitting. And that is where my online program, the Hip Lab, comes in. So I created this over the course of the past year. I just launched this version of it about maybe 6 weeks ago. And I can tell you, the people that have been in this program have had such good results already. They went from never being able to squat ever to, I'm squatting, 3 sets of 10 with weight and having zero flare-ups. Or walking, I had somebody say that they had walked, I think, 3 miles, and before that would have set them into a flare-up, and it was fine. They were good. So it really, again, you don't have to be in front of me to get these results. So what is the Hip Lab? It basically is a self-paced program that's going to walk you through those 4 phases that we talked about. And it's going to show you inside of each phase, what do you do and how do you kind of put all of this together. So there is some of what we've talked about here, like, how do I breathe? How do I do the rock backs? How do I find my calming exercises? And then we move into, okay, now that you've done that, how do I optimize movement? What are the movement patterns that you need to change? How am I even moving? And then how do I correct those patterns? And then some early movement resets that you can do to start to fix the movement patterns. It then moves into, okay, now how do I layer strength on top of all of that? And again, it's not a step-by-step exercise plan to follow, but it is going to give you suggestions of what types of exercises that you can put in there. And the coolest thing about it is, as I mentioned, like way back in the beginning, I don't believe that it's one magic exercise that's going to change it, but it's learning how to move. And once you know how to move, you can apply that into any exercise that you choose. So it really makes it very adaptable to whatever it is that you're doing or whatever you want to do, whatever your goals are. And it works excellent alongside physical therapy. So if you're already in physical therapy, it works so well alongside of it to fill in some of the holes that your therapist, if they're not a hip specialist, things that maybe they're not looking at or never even thought of going over with you. So it is okay if you're already doing physical therapy. So within it, there are basically kind of bite-sized videos. Nothing is too long. You can watch them whenever is convenient for you. And then alongside that, there's all kinds of like PDF downloads and resources and things to help you follow along and track your progress and know what to do. And then at the end of each phase, there is a kind of like a checklist of, okay, if I can do all these things, I'm ready to move into the next phase. So the program is designed to go out to you in for like a 4 week time span where you could watch, one phase per week, but it generally takes people about 3 months to work through the entire program and feel like they've actually made progress in each of those phases. So it's not tied to a specific time frame, but rather how your body progresses, and you get to go at your own speed, which is really cool. The other thing that you get as part of this is access to our private Telegram group. So I am in that group. I check it every day. If you have questions, you have access to me, ask questions, and I can answer however, whatever you need. And you also get to connect with one another. I think it can feel like a really lonely journey sometimes having this type of pain and injury going on. And so it's really cool to just be able to connect with others and figure out what is working for them, what is not working, celebrating wins, whatever it is, you guys can all connect through the Telegram group that way. So right now I am opening the doors again for the next group of people. I am only taking 10 for this group. Like I said, I still try to make it, although it's self-paced, I do try to give you guys access to me. So I'm not letting a ton of people in so that I can still answer questions and all of that. So right now I have 10 spots available. If you join by Friday, you are going to get extra bonuses. So you'll get a free pre-order copy of my book, which fingers crossed will be out by Thanksgiving. It's coming, I promise. And it's called Hip Impingement to Hope, and it kind of follows along the same premise that the course does, but it's all in the book. So you'll get a free copy of that when it's released. You'll also get access to a bonus live group Zoom Q&A call. So you can come on, you can ask questions. We can work through some of your problems that you're having together, and you'll have access to that as well. And also, after Friday, the price is going to go up $50. So if you do want to lock in the price at what it is right now, which is $299 for the program, sign up. The first 10 people to sign up before Friday will get that pricing. And then after that, it's going to go up $50. So it'll be $350. So if you've been on the fence, if you guys have seen anything about this, if you've been on the fence about joining, I would say now is the perfect time to join. And of course, if you have any questions, do not hesitate to reach out to me, because I'm happy to make sure that it's going to be a good fit for you. I want to make sure that you'll really get something out of it. All right. So, also really quickly, I'm gonna share my screen, because if you guys are interested, I will email this info as well. But if you are interested, I'm gonna put up, I have a QR code right here. I'll just share it really quick. So that way, if you're interested, you can just scan the QR code on the screen and you will be able to sign up right through that link. It also has all the information. So like the ins and outs of what exactly is included are all in there. So if you need that, I'm gonna take it off the screen in like 3 seconds. All right, perfect. Okay, so then I'm gonna just look to see if anybody had any questions for me. It doesn't look like I have any questions in the chat, but do you guys have any questions you want to ask live? Feel free to unmute yourself and ask away. I'm happy to answer whatever questions you have. Anybody? It's okay if not to. All right. Okay, last chance. Going. All right, cool. Okay. Well, if you guys think of anything after, please do not hesitate to reach out. I will email you the replay. You can just reply to the email, ask whatever questions you have. I am so glad that you guys chose to spend this hour with me. I hope that it was eye-opening for you. And I really, oh, yep, I can put the QR code back up. I hope that it was eye-opening. I hope that you gained something from it. And if anything, if there's one thing that you could walk away from today with, it's that I hope that you realize that there is a lot of hope, that there is something that you can do for this, and you're not just destined to live with pain forever or have to have surgery. There are things that can be done. You just need to find the right strategy to get there and have the right person behind you that's gonna walk you there. So thank you guys for coming, and we'll see you all soon. Bye.